Continuing on with the digestive system, question 17 is, what is the structure indicated by the arrow? And we can see the arrow here in yellow. What is this structure? And the correct answer is the liver. The liver is one of the accessory organs of the foregut, along with the gallbladder, spleen, and pancreas. Also reminded that the foregut includes the distal end of the esophagus, the stomach, and the first and second parts of the duodenum. Question 18. Which structure in the male reproductive system produces sperm and testosterone? And the correct answer is the testes. And we can see the testes here with the seminiferous tubules. And from the tubules will be the rete testi, and that will drain into the epididymis. And we can see the head of the epididymis, the body and tail of the epididymis, and that is going to drain into the ductus deferens, also known as vas deferens, but more correctly known as the ductus deferens. And the ductus deferens will then travel up through the spermatic cord and eventually meet up with the seminal vesicles in the posterior aspect of the prostate gland to excrete its contents into the prostatic urethra. Question 19. And this is a true or false question. The female urethra is shorter than that of the male urethra. Is that true or false? And the correct answer is true. We can see here in a side-by-side representation of the male bladder and urethral system versus the female bladder and urethral system. We can see that the male urethra has four parts: a pre-prostatic urethra, a prostatic urethra, a membranous urethra, and the spongy or penile urethra. So in comparison, the female urethra is much shorter than the male urethra. This allows for foreign substances such as bacteria and viruses to be able to travel into the bladder and urinary system in the female much easier than it is in the male. And our last question, where does fertilization of the egg occur in the female reproductive tract? And the correct answer is the fallopian tube or the uterine tube, and we can see that here. And the uterine tube has several different parts: the fimbriae, which are in close apposition to the ovary, the infundibulum, or the funnel of the fallopian tube. The next portion is the ampulla, and then the body of the fallopian tube. And the last part is the intrauterine portion of the fallopian tube, which empties into the uterus. So an egg is going to be released, enter into the infundibulum, and at the area specifically of the ampulla of the fallopian tube is where fertilization with the sperm should occur. And that is all I have for you. I want to wish you all the best of luck in your preparation for the upcoming examination. Best of luck to everyone.